Hair being the critical factor in your looks, the continuous loss might have started affecting your choices in terms of hairstyles. Which means, you have started compromising on desired looks. Moreover, a few of you might also be encountering awkward and embarrassing situations when your hairs are falling in your work area, living room, and the worst in your kitchen and lunchbox. These uninvited situations at times result in taunts and comments from coworkers and family members. You have tried so many solutions including shampoos and oils. What you get is at the max temporary results and at times other side effects such as loss of shining, thin hairs. What is losing hair? How to stop hair loss with home remedies right away for women. Your hair grows, stays on your body for a while, and then falls out. When hair falls out faster than it grows back, this is called hair loss. Hair loss has become a way of life. Stress. Hair loss can be caused by too much physical stress or constant emotional stress. Bad nutrition. Hair loss can also be caused by a diet that isn't well balanced, like one that is low in proteins, iron, and vitamins. Hairstyles. When you wear tight braids, ponytails, or cornrows for a long time, the roots of your hair become weak, which can lead to hair loss. Heat styling tools and tight hairstyles can damage hair and lead to hair loss. Harsh hair care products. Using hair dyes and relaxers, which contain harsh chemicals, on a regular basis can damage the hair and cause hair loss. Lack of sleep. Not getting enough sleep can change the levels of hormones and mess up the hair growth cycle. The health reasons are hormonal imbalances. Hormonal imbalances that last for a long time, especially during pregnancy and menopause, can cause hair loss. Problems with health. Hair loss can be caused by things like thyroid problems, not getting enough iron, and autoimmune diseases. Certain medications, like blood thinners, antidepressants, birth control pills, and cancer drugs, can weaken hair and cause it to fall out or fall out altogether. If your family has a history of losing hair and going bald at a certain age, it's likely that you will too. Your hair loss could be caused by one of these things or by a combination of a few of them. How does hair loss happen in stages? Normal hair loss. It is normal to lose 50 to 100 hairs a day. If you only notice hair loss when you comb or brush your hair and the number is up to 50, you don't need to worry. But if you start to see more hairs when you comb or brush, or if you find hair on your pillow, in the kitchen, or at work, that could be a sign that you are losing too many hairs. This is the stage when the density of hair has begun to diminish, and you may begin to see spots where your scalp is more apparent. This stage is characterized by the appearance of bald patches on the scalp. This means that hair development has been fully halted in certain locations. At this stage of baldness, a considerable portion of the scalp is exposed and advancing towards total baldness. What will happen if nothing is done about hair loss? If you don't take your hair loss seriously and don't do anything about it, the next stage of hair loss will happen. If your hair is normal, it will start to thin, then go bald in patches, then go partially bald, and finally go bald all over. The rate at which the stages progress will depend on what's causing your hair loss or what's causing it all at once. The sooner you start to deal with it, the better. If the follicles, which you can think of as the roots of your hair, start to break down, the treatments start to get less effective. Continue next part 2.